Hi, I'm Dr. Ellen Braaten. I'm a child psychologist and a consultant with the New York State Project Teach program. I'd like to take a minute to talk with you about some of the changes you may want to look out for when it comes to your child's mental health, specifically if your child is between the ages of 6 and 12. Kids change quickly during this time period, and the concerns and questions you ask your pediatrician will be very different depending on their age. Use our suggestions as a guide. You know your child best, and if you have concerns or questions, your doctor is there to help you figure out whether there is truly cause for concern. As kids get older, they use the basic skills that they've mastered in the first 5 years of their life to broaden their world. Educators say that by around age 9, kids move from learning to read to reading to learn. Children also learn the value of complex rules for board games, video games, or games that they play outdoors. Imaginative play becomes more complex, with more in-depth storylines and more consistent themes of power and the ability to accomplish tasks. Certain mental health problems are more common in this age group as well, and the concerns parents have can range widely. For example, a depressed pre-adolescent may have lots of physical complaints, stomach aches or headaches. Children with ADHD might have a hard time resisting the normal temptations that other children learn to manage. Problems with learning can become apparent at this age when development of reading, writing, and math skills are so important. You may hear about these issues from your child's teachers. After all, this is the beginning of the transition where kids spend much more time in the classroom than when they were younger. Part of a parent's role at this age is to bridge the gap between the classroom and the doctor's office. If your child is stumbling in any of these important school-based tasks, let your doctor know. And to prepare for your child's doctor's visit, ask yourself these questions. Does your child seem happy? Does your child have a lot of worries? Does your child read? What does your child read? Does your child have aches and pains? How's your child sleeping? How is your child eating? How does your child respond to frustrations? How does your child respond to limits? Does your child have a best friend? What kinds of things do they do together? Does your teacher have any concerns about your child? Does your teacher worry about your child's ability to pay attention? Do you have concerns about your child's learning or behavior, but the teacher is telling you not to be concerned? Remember, there's no wrong answer to these questions and no answer that guarantees there's a problem. But if your answer makes you think, look at your thoughts as an opportunity to ask more questions, and definitely involve your doctor in these discussions. To find more information about what social and emotional developmental milestones children reach at this age, take a look at either the Guide for Parents of 5 to 10-year-olds or the Guide for Parents of 10 to 12-year-olds brochures available on our website.